Good afternoon. Welcome to the Dr. Truth Show. Dr. Michael Hall speaking to you live October 16th, Friday afternoon in Miami Beach, Florida. Today's podcast will be a discussion about the U.S. healthcare system or lack thereof. We had to add that just because it is really sad and laughable that the richest country in the world that prints money like there's no other country that can print money can't have a healthcare system without spending trillions of dollars a year and really having very poor outcomes from every metric with regard to health. And I say that because I've studied this. I have a professional background in healthcare as a doctor, and I also have an academic healthcare background as a researcher. I have a background in healthcare management and policy from a very reputable New York institution, NYU, and actually really wanted to change healthcare when I was younger by becoming very political with regard to some of the things that I occurred and monitored and was witness to when I was doing my residency in ophthalmology at New York Hospital Cornell. That was in 1996, a long time ago. And at that time, I saw racial disparity in healthcare delivery. Essentially, black patients not being cared for like white patients. And that caused me to react in a very outspoken way. And I made a memo regarding one patient who was an African national Senegalese cab driver who got a injury to his eye, a ruptured globe, quote unquote, which is a type of penetrating eye trauma, and that caused him to have blindness. But during the process of him coming to hospital, the attending physicians would not come in when they found out that he was poor, that he was not insured, and that he was not an American, and he was an immigrant. So there are multiple levels of racism and elitism, whatever you want to call it. We know about this, and now 25 years later, we see these movements all around us that are still protesting disparities when it comes to race in law enforcement and other areas. So that's a different discussion. But I can tell you that as a young resident, I was very enraged by the fact that my patients, and two of them were black and two of them were from the other side of the tracks. They were not Upper East Side wealthy clients that could pay through insurance or fee for service, which is cash. They were Medicaid or Medicare-based payees, and that the hospital and the staff denied them care because of that. And that became a federal case, and you can look it up. And it became a case that went even before the New York State Department of Health, which they found the hospital guilty. And the New York Times in 2006 wrote about it. That can be archived and retrieved if need be. But the point is, people are motivated to go into medicine for a variety of reasons, and one is called worker sorting. It's a nonprofit organizational term that people want to help, and they will go into nursing or healthcare as a physician or extender of a physician, nurse practitioner, physician assistant, because they want to help people, because that's why they're motivated. They're not motivated for money. They're not motivated by fame. They're not motivated by ego. It's really, they're motivated by the process of caring for another human being in their time of need and finding satisfaction in that. And that term, interestingly enough, is not really applied to our healthcare system as we see it, because we have a for-profit system. It's a business. It's not a healthcare system as we would envision it as an entitlement. So what happens are people enter the system that are sick, and they are tiered based on their wealth. And it's called means testing. Means testing is basically the segregation of those that can pay and those that cannot. And we see that with the way that Medicare is delivered. If you've got more money, then you buy additional health care to fill in the gap of where Medicare may fall short, and that you get better care versus someone that cannot afford that insurance or those extras, and they have to kind of use what's given to them. And that goes across the board. That can be applied to almost any aspect of our healthcare system, not just Medicare. Medicare is a form of healthcare that was designed early in the Kennedy administration, and it was part of a movement to ensure that the elders had some sort of care that were retiring, because many people did not have savings and they could not have access to care. And that was becoming a huge issue as the society evolved, and it still is. But I won't go into that. That's not the topic. The topic really is our healthcare system as it exists today. And if you want, you can break it up into about 8 different healthcare systems. We don't have to define each one, but essentially the first one is insurance-based. So that would be employer sponsored, so that your employer pays a portion and you pay a portion and you get insurance and you have a job, and the job allows you to afford health care. And many people that move from one job to another lose that, and then they need COBRA insurance, which fills in the gap until they can find insurance with their new employer. The second would be fee for service, and that would be basically you go to a doctor, you pay cash out of your pocket, and you get to write it off your taxes, or you have a medical savings account and you can use a charge card and retrieve the savings by bypassing the taxes on that money spent. So you actually save money by having medical savings account, which you load with money each year, and you use that toward an optometrist or a dentist or a doctor that may not take your insurance, or if you don't have insurance, you just bypass it completely. Next, there's Medicaid, which is typically for poor people that are less than age 65, and their children typically are part of this, and they're people that are on welfare. So Medicaid gives them an opportunity to see a doctor without paying for it, and typically they can see any doctor that they want, anytime they want. So they can go to an emergency room and not have to pay a copay or any extra payment. They can go and typically get whatever care they need at a point of service without having any responsibility financially. That's a problem because people then tend to abuse that, and system expenses go way up because there's no accountability. But that's just another facet of the fragmented healthcare system we have. There's Medicare, which is for elders, people over age 65, and that pays for both drug payments, doctor's visits, and hospitalizations. There's Part A and Part B. We won't go into that, but that's just another element of the division of healthcare as you go down the tree. Then there's the VA, which is a whole nother healthcare system, and that's set up for veterans that have served. It could be Air Force, Army, or whatnot, and it could have pre-existing conditions or conditions related to their service overseas or domestically. And then there's a whole different kind of healthcare system that's built around the prison system, and that is its own animal. We won't go into that. There are other healthcare systems, Indian healthcare system. There's the Puerto Rican healthcare system that's different than our healthcare system. There's a lot of different healthcare systems under the umbrage of the American healthcare system. There is no one size fits all, and it's very fragmented. And one of the reasons why it is fragmented is because, again, it's a business. So different groups make money different ways. And one is prescription medicine, so pharmacies. There are pharmacies that kind of act in their own way as a healthcare entity into themselves. And you have giant for-profit organizations like Walgreens and CVS, which are on every street corner. And they pretty much dictate to the American public what they can or cannot get and the costs involved. And then, of course, you have governmental agencies that come in between. Could be FDA, could be DEA, and they organize and structure certain medications approval or disapproval, and that becomes a whole other issue, but that is tied into that pharmacologic delivery system. Then you have hospitals. Hospitals are huge cost centers because they're typically for-profit. Very few are not for-profit. So they make money off of you being sick. So those are the bad stories we hear about when you get bankrupted, when you go to a hospital. And that would be, for instance, you go in to the hospital because you fell off your bicycle, you don't have insurance, and you broke your arm. So you go through the ER, and the ER then assesses you, does the x-rays, the blood work. You go in for surgery. The orthopedic surgeon comes in, sets your arm, puts a rod or a pin in. And then after you leave, you get a bill for $80,000. and you make $12 an hour. So how does that work? Why do you get a bill that you know you can't pay for? You could probably never pay for it. And it's enforced through a court system that prevents you from buying a home or having a normal life because your credit is ruined, because you basically have to bankrupt yourself in the courts to prevent them from stealing your wages for the rest of your life. That's called garnishment. So that's a worst case scenario, but that's happening all the time. And the number one reason Americans file for bankruptcy are because they have unpaid medical bills. And I'm not sure which generation is going to fix this. I think that Democrats and Republicans alike don't seem to want to fix it. Of course, there's Obamacare. We didn't talk about that healthcare system. That healthcare system is subsidized by the government and provides healthcare for people that are not really making too less or not making too more, meaning that they don't qualify for Medicaid and they're not ready for Medicare. And they have subsidized healthcare on a free market that really isn't free, that only opens up once a year and makes no sense whatsoever and is very costly and unfortunately is not very responsive to their needs because costs go up, premiums go up every month, every other month, and people can't afford it, and then they just stop buying it. Okay, so that's a whole nother discussion. But Obamacare was built around a premise of failure to usher in a one-payer system. And we know that from the MIT academics who created Obamacare. And we can get into that if we want. But people think Obamacare is some miracle that has been projected on us from the high above courts and leaders, and that's not true. And I wish it were true, but it's not. So bottom line, we have a healthcare system that's a business. It's completely failing the American public. There's no accountability. There's no customer service. No matter how much money you have, if you're a billionaire or you're a pauper, the healthcare quality is low. Most people are not satisfied with their healthcare experience. The customer service, as I mentioned, is usually abysmal, no matter what point you enter. And if you have to go to emergency room or you have to go outpatient to see a doctor for a procedure, typically there are many steps involved. There is redundancy in the system. Oftentimes doctors do labs 2 or 3 times before they even commit to a procedure because one hand doesn't know what the other is doing. There's no reasonable and equitable way of transmitting information from one hospital or doctor to another. And that redundancy gets costs elevated to a point where none of it makes sense. It would be better off if we just stopped enforcing the laws and the codes and just went back to a single payer system and gave people money to buy their health insurance locally, and that they could arrange some sort of co-op to provide for their community and work within their community to get the services that they need, because that's really essentially what people want. People want to shop locally and pay locally and have a relationship with their doctors and hospitals. They do not want to have to go through Aetna or United and call people based in India to try to get approval, being a doctor or a patient, and go through these horrific waits and uncertainties before they can get the care that they need. And oftentimes the care is then denied and they get a bill. So really the essence of this talk, this is going to be part 1 of 3 parts. I just set the stage for a discussion and probably for a number of people, a head scratcher, a foot kicker kind of thinking, because they know intuitively things are not right. They know our leaders haven't proffered up any solution that works. And we keep going round and round and round. And there's always been this discussion on who's really in charge. And we know we're not. And industry's in charge, whether it be hospital industry, the pharmaceutical industry, the lobbies, it could be doctors, it could be nurses, whatever. But the patient really doesn't have a voice. And until there's a tremendous upsurge in patient noncompliance, meaning that patients just opt out of what they're doing and build a new system, which I think is possible. And that's the talk for next time will be, what's the new system? What can be built out of the ashes of this one that can serve as a better model and a better experience. And I can tell you, I've traveled around the world and I've worked in different healthcare systems, including in New Zealand and India and Africa. And I've seen what can be done in a much simpler way, much more elegant way, less paperwork, much more streamlined, and more local. And I think that is the way things will go. I think that's the way everything's going. But until then, I wish you a very good weekend, and I hope that my discussion sets you into a mindset of looking at what it is that we can do to improve things as we go forward. Have a great, great weekend, and thank you so much for listening.